Okay, off we go to a super crazy case. This is gingival hyperplasia due to calcium channel blockers. You can see I removed his prosthesis that was full of bacteria, completely unable to clean. He had a bunch of custom abutments with really poor margin design. As you can see, the tissue is really horrible. Good thing the screws were not stripped, and you can see as I remove the abutments how much bacteria is stuck subgingivally that created this issue in conjunction with the calcium channel blockers, because we know with calcium channel blockers it's not just the issue of the medication, but in presence of bacteria we have all of this. I go ahead and make sure it's numb at the base of this lesion, and the anesthesia really leaves very quickly in this area. We go ahead and place chlorhexidine on all of the implants to try and clean whatever leftover plaque or calculus is stuck. And now we start to cut away on cut coag mode with a cautery, the excess tissue, and at the same time sort of creating this new bed for the temporary prosthesis to come in. And we do it slowly and slowly and clean so we can see where we're at. And we go at the base and pull. Obviously you can see it's extremely vascular. After we remove the majority of the tissue, we now switch the electrosurge to just coag to help us control this bleeding before we move to the other side. It's very important to make sure the patient is extremely numb in these cases, because they really feel a lot of pain if they're not from the electrosurge. And now we go on the pallet and remove what we need to again. And now we go at the base to remove it in one big chunk. Now that we have the idea of what the right side should look like, we go to match it on the left side. This is probably one of the funnest parts of this procedure. Maybe we call it dental liposuction, who knows? But off we go. Remove. Nice big piece is gone. And now we do the palate. These were internal hex implants. They've been placed a super long time ago. They do have bone loss, as you'll see when we go and do the tissue punches to remove the granulation tissue around the collar of the implants. But this is very much expected with this type of implant design, an extremely poor abutment design. So we are planning on not just removing the tissue, but moving the implants to the abutment level so that we don't have this subgingival issues in the future. Remove. And our decision is that once we torque the abutments, if the implants spin, we'll remove them. If they hold the 35 newtons of torque, we will go with it. And now we start to place the multi-unit abutments. These are 17 degrees. We try to bring the margin equigingival. We're going to have a lot of resorption in this area, so we will follow this up in about 2 weeks to see where we're at. This one's, I think, a 30 degrees because those back implants were placed at an angle 15 years ago. And with the internal hex, it's unlike a conical connection. It's kind of hard to really place it to figure out if you're seated all the way. But we're at 35 everywhere. We're trying to get as much path of draw as we can. As you can see, there's going to be a lot of blood in this area, so the intraoral scan, when we take the record, may be distorted, so we're going to add photogrammetry to this case. This is the Tupel photogrammetry. Unfortunately, we lost one of the posts, so we're only going to go able to do 5 and then merge the scan. And this is now done. We take our second scan after we moved the post a little bit further back so that we can merge the two scans. Now we go ahead and put the THS caps on top. We're going to use Trios 4 for a case like this. And this works really, really well. After we go ahead and we place the XCELL jig to set the bite or the vertical dimension, we align that on top of the THS caps. We go ahead and we design everything, and now we go ahead and we add some blue paste, blue M, to help with the tissue healing prior to placing the prosthetic. And now we go ahead and place the prosthetic with minimal pressure on the tissue to allow the tissue to really heal correctly and not try and grow over the prosthesis again. This is C-Temp material from DentaFab. It's really nice and translucent. And these are Powerball 1.0 screws, torqued down to 15 Newton centimeters. Make sure the vertical is correct, and we'll check the midline, and the patient will go home. And the bite is perfect. And then we are all set. And this is what we learned from this case, that you need to manage it correctly, use the technology available to you, and more importantly, let the patient go home with a non-ill-fitting prosthesis. Subscribe for more so you can hear and learn more of the XCELL implant process.